A substantial body of evidence suggests farmers experience a disproportionate burden of health problems, specifically in relation to cardiovascular disease and mental health. Additionally, due to the geographically isolated nature of farming, farmers are seen as a hard-to-reach group. A key asset for farmers is that agricultural advisors are uniquely positioned to support farmers on health issues. However, our findings suggest that agricultural advisors feel ill-equipped in their capacity to engage with farmers on health issues. Feirm Ground aims to train agricultural advisors who meet farmers on a regular basis to equip them with the skills and competencies to engage with farmers on topics associated with mental and physical health. This project is broken into 4 distinct phases. Phase 1 explored farmers and other key stakeholders' perspectives in relation to farmers' health and help-seeking behaviour, with a view to providing actionable recommendations to inform the design of the training programme for agricultural advisors. The most important cog in the wheel was a quote from a focus group participant, and it was used in the context that farmers had lost sight of this. They had lost sight of the fact that their health is the most integral aspect to the overall welfare of their farm, and rather soldiering on and staying strong in the face of adversity was the norm to live by. The inbuilt culture among farmers, as demonstrated in this study, was to suppress emotions and help-seeking behaviour, as illustrated in the following comment by a female farmer. "You know, there was this conscious thing, if I was going to get my hair done, I was selfish. To go to the doctor to check something out, I was selfish. You know, because maybe you're only looking after yourself and not thinking of other things." Our findings suggest that farmers' identity was shaped by traditional masculine norms that revolved around the farmer as a hard worker, battling against environmental and economic obstacles and exerting his authority over the natural landscape, all the while suppressing emotions and help-seeking behaviour. We found that such entrenched masculine norms posed a major barrier for farmers when engaging with health and help-seeking behaviour. There was a sense that real farmers don't ask for help. Seeking help was seen as an admission of failure and had an emasculating effect to the traditional norms that farmers felt they had to live up to, with one farmer stating, "I would say the old perception of we are hardy and we are men and we are okay, we don't have problems, that's the perception." In many of the focus groups, the female of the household was considered as the gatekeeper of the farmer's health. This deferred responsibility away from the farmer in engaging with their health. Health was seen as female business and not something hard-working men should engage in. Farming is one of the highest occupations associated with suicide. We know there is an imbalance in help-seeking behaviour among males, and more specifically, farmers. The aim of this study is to understand how mental and physical health difficulties are experienced by farmers, and to provide training and support, and to break down the barriers farmers encounter in dealing with their health.